Well, to talk more about the rollout of the polio vaccine in Gaza, let's bring in Dr. Jane Crawley, a paediatrician who's also taught medical students in Gaza. She joins us live from Oxford here in the UK. Dr. Crawley, thank you very much for speaking to us here at TRT World this evening. Now, the WHO says the rollout's ahead of schedule with their polio campaign. What's your assessment of how it's going so far?
Well, I think they're doing an amazing job under incredibly difficult, unbelievably challenging conditions and very dangerous ones. I've been incredibly impressed by the number of people that have turned out to get the vaccine, and all credit to the teams for doing their very best under very, very difficult circumstances.
When you say very, very difficult circumstances, which are the most or the biggest challenges when it comes to the distribution of this vaccine?
Well, we've got mobile teams trying to reach people, and we know that the roads are often impassable. There's always danger of missile attacks and unexploded ordnance. It's a very hostile environment. So to be doing something as ambitious as this is really incredible. I have to say, let's just remember, though, that the real vaccine that's needed is peace. I quote here the Director General of the World Health Organization. This is a laudable effort, but in the end, you're vaccinating children. If you then bomb them the next day, then how outrageous is that? So at the end of the day, this is a great effort, but we have to have a ceasefire.
And Dr. Crawley, the focus has been on central areas of the enclave of this polio vaccine. What's next for the campaign? Does this type of vaccine require another dose? And what plans are in place for the distribution of that second phase?
Well, yes, you need 2 doses of polio vaccine. And I understand that the second dose will be given 4 weeks after the first, which requires a repetition of everything they're doing now, plus the delivery of the vaccines. And if we no longer have humanitarian pauses, that raises hugely logistical challenges.
But when I introduced you, I mentioned that you taught medical students in Gaza for 9 years, or over the last 9 years. Are you in contact with any of them who remain in Gaza, and what do they say?
We're in constant, our team, I'm part of a group of clinicians from Oxford who have been visiting every year up until now. And we are in close contact with a lot of our colleagues there who are working in, they're seeing things that no human being and should see. Outrageously damaged children, dead, blown apart, burnt. And every doctor's nightmare is to actually deal with children when you actually haven't got the resources to do a good job. And they're all working in conditions often with no electricity, with limited running water, the inability to therefore, clean your hands often adequately, running out of medicines, bandages, everything. It's just about as bad as it could get. And I think it's extraordinary, the dedication with which they just keep going.
Indeed. You did mention that lasting peace is the only way that anyone can actually save these children. How effective will this rollout be against polio? While we mentioned what else could save these children, if they're still drinking contaminated water and the spread of many other diseases, not just the spread of polio here that's at risk to them, and of course the continued strikes.
Well done. Absolutely right. The fact is, polio is one infectious disease. You've got a situation there which is absolutely a recipe for infectious disease disaster. Massive overcrowding, very, very limited clean water. And in that situation, it's not just polio that spreads, but also hepatitis, other diarrheal diseases. There's big potential for cholera. And we're talking about a population who are very vulnerable anyway because they're malnourished. And a lot of the children are suffering from malnutrition. And when you suffer from malnutrition, your ability to fight infection is impaired. So it's it's a disaster waiting to happen. As I say, this is a very laudable effort, but it's a drop in the ocean compared to what's actually needed, which is restoration of infrastructure, restoration of water, adequate water and sanitation facilities, and a lasting peace.
Dr. Jane Crawley, we really appreciate your time. Thank you very much for speaking to us here at TRT World this evening.